Well, it is 11 o'clock, but I think we'll give folks another minute or two and then we'll get started with today's talk here. All right, well, I think we'll go ahead and get started. So I'll start with kind of a couple of announcements and then we'll get to our speaker for today. So first of all, thank you everyone for joining us again for this month's small business webinar. And I'd like to thank our regular sponsors, which is the Small Business Development Centers across the state of Montana, Small Business Administration, MSU Extension, Montana Economic Developers Association, Montana Department of Commerce, and then Grow Great Falls, the University of Montana, and Big Sky Economic Development. So thanks to all those organizations that help make this series possible. Couple of just kind of housekeeping notes. So first of all, we're not going to have PowerPoint slides today. So when Steve takes over, we'll just be seeing Steve, his image for their presenting. And if you would like, if you go to the top right corner of where the everyone's pictures are, there is a speaker view. So just the active speaker will show up as a larger image than the rest of us that have our camera on. So that's a choice of yours, or you can leave it in the standard grid view. We're happy to take questions through the chat window. So it's minimized in the bottom right-hand corner of your screen. So you just need to hit that chat button, it'll open up. And then you can send questions either to everyone, or you can send them specifically to me and I will ask them to Steve when we get a chance or a pause in the presentation. And then following Steve's kind of formal presentation, we will open it up to questions. We'll catch up with anything in the chat window we haven't covered, and then we'll invite folks to unmute at that time if they would like to just answer a question verbally. So now the final announcement I want to make is just about next month's webinar, just so you know. Thursday, November 5th, again at 11 o'clock, we're going to have Understanding Credit Card Processing, and we're going to have Stephanie Cummings join us as our presenter for that. So mark your calendars for November 5th if you haven't done that yet. Now, with that, I'll introduce our speaker, who I'm pretty excited to hear from today. I had a chance to interact a little bit with Steve earlier this week, and I'm even more intrigued about what he might tell us. So Steve has a pretty interesting job. So he works in Missoula County. He's the liaison officer for the COVID Response Incident Command staff. He's also chief of the Reserve Deputies for Missoula County Sheriff's Department. Also has a background in advertising. And is also currently working on some additional training through Arizona State University, another graduate degree there in some emergency management and homeland security issues. And he also mentioned, and this is very relevant today, that he had the chance to know Magic Johnson back in his college days. So that's clearly highly relevant to today's topic. So with that, Steve, I'm going to turn it over to you and encourage folks to please send questions in through the chat window.
Sounding good? Good. This information webinar is going to feature my opinions. I want to say that off the bat. It no way reflects official policy of the Missoula City County Health Department. And with that out of the way, I have a sort of an eclectic set of experiences, as Joel said, from my perspective, to apply my skills to what I'm doing here. And I'm the liaison officer for the Incident Command. And if you're familiar with incident commands, they form during an incident, and the incident is COVID-19. And it goes from the federal level down completely to the local level with a long chain of command that includes the federal government and FEMA and Homeland Security all the way down to your local county. So the larger counties in Montana all have my function, but the smaller ones often do not. I began my career years ago in advertising, moving up to management, the world's largest ad agency. Big clients. I was based in Detroit, New York, and London. And if you're really old like me, you saw my commercials on the Super Bowl back in the 80s. I came to Montana 30 years ago, and I've run my own marketing services business that still exists today. I do location scouting, location management for film and commercial production companies from around the world. And some of my clients are like BMW in Munich and different entities like that, and motion pictures. I've also been an active reserve sheriff's deputy in Missoula County for 16 years. And as Joel mentioned, I was the chief. They no longer have a chief. They've reoriented how that program works. But for many years, I was the chief of that program, and I'm still in it. I'm currently in a graduate level Homeland Security Emergency Management program administered through Arizona State Center for Emergency Management. My focus has been how to respond to an intentionally human-caused worldwide disaster. So that's, for the last 2 years, that's what I've focused on. So in early 2020, like the rest of us, we're like, oh, 2020, here we go, it's gonna be great. I was gearing up for a really exciting project in the Middle East for this, and I was basically gonna relocate to the Middle East, and it was all canceled. So when the Emergency Operations Center asked me to help my community, I took this current role as a temporary employee. So I'm attached to the health department, and it's been fascinating. I've learned a lot. I'm going to share some tips with you to simplify things you've probably already heard, but mostly we're going to face up to some good old common sense together, because that's really what's required. So what have we learned so far with this incident? We call this pandemic illness COVID-19. The actual virus originated as a derivative of the once renowned SARS virus in China in 2003. Why all this background is important is it spread through international air travel, and SARS put the World Health Organization on the map. It was really its first big success. So our current virus is called the SARS-CoV-2, meaning it's another version of SARS. Montana's first confirmed case of what we call the illness as COVID-19 was verified March 11th. This implies, for simplicity's sake, this virus comes out of a Pandora's box of an unlimited potential offshoot of more viruses to come. So while this is one virus, they know that there are endless variations of this possible in the future. And there is a geometric increasing relationship between human and animal contact viruses coming down the pike. This is meant to scare you and to condition us for the future. We're in this current public health mode, possibly for the long haul. I wrote an academic paper on this subject. Asia has already experienced a rash of these viruses, and their society already has more than 25 years experience dealing with these masks, these lockdowns, and all these quarantines. So when you saw this happen, and you saw that it first started in Asia, the folks in China and Japan, this is old hat. They've done this. I was there 20 years ago, and they all had masks on, and they're all afraid of their neighbor, and they already have a mentality in the way their government and their society is designed to lock down. So they sort of are used to this. But in the U.S., you know, they have homogenous society. They're prepared to cope with these disasters in that way, and they have totalitarian control. But this isn't the plan, as we know in the United States here. Our free society doesn't want to be told what to do. So we've been hit pretty hard. Now, you hear a lot of facts about how the U.S. is worse than everywhere. This really isn't true. According to the respected magazine, The Economist, this past September 26th issue, there's a current list of the deaths per 100,000 population. So of the countries that provide reliable data, Peru is the highest. They have 96 deaths per 100,000. After that, we have Belgium, Spain, Bolivia, Brazil, Chile, Ecuador, and then Great Britain. Great Britain still has more deaths per 100,000 than the United States. They have 62 deaths per 100,000 population. And you heard me say that Peru has 96. Almost all of Europe has between 57 and 59 deaths per 100,000. So in truth, don't listen to the media, because most countries are experiencing similar rates of dynamic impact, which is deaths. Actually, we're actually rather normal for our population. So my point is, it's hitting the whole world very similarly, which is interesting to note. It's not like one, and all the efforts of all the health departments and things could help put the brakes on, but they're not changing this giant natural tide that's happening around the world. But you can do everything you can here. So we locked down early, and then we opened up, and the whole world did the same thing, perhaps prematurely, for economic and political reasons. We're polarized into factions as to the disaster severity. So I believe that for the type of society we have with our values of freedom, we've responded pretty well to this crisis. We have a robust NIM system, which is a National Incident Management System. It reaches from, as I said before, from the federal government to the local level. You can trust if your local officials are following these guidelines and protocols of professional management. They're supported and thanked for their hard work in managing. This is the broadest, most subtle single natural disaster ever in world history. So that's what we're dealing with. Where's the balance? What have we learned as this incident has reached a new upward trend? And the trend is in the youth, as we'll discuss. What this requires is discipline and perfect execution of safety protocol. That's what's essential. The point I want to make is that masks work. They do work. This is an undisputed fact. A mask sitting under the nose and not covering your nose, that's not a mask at all. We've all seen that everywhere you go. In retail stores and around and places, people with the mask and their nose is poking out. That's no mask at all. They're not wearing a mask. And I tell people, put your mask on. You know, I just do that. And don't accept this childish excuse from anybody you encounter because it's not valid. Put the mask on over your nose. Everybody encountering anyone else with whom you don't directly live should be masked up. It's just smart. Think of the odds every time you're exposing yourself. Every time you touch anything sketchy, go wash your hands. Wash your hands all the time. Wash them often. Wash your mask every day. It's okay to tell people to mask up if you want to speak with them. When I see people, I go, excuse me, do you mind? Please put on a mask. And pretty much they'll give you a look and go, oh, and then they'll put it on. They'll comply. Maintain 2 meters or 6 feet of distance with people. That's just courtesy. It shows other people that you're considerate. It's okay to leave an establishment you feel unsafe after your observation. I've walked into places and went, ugh, and you know in your heart, you just get this little feeling, gee, this is low. I don't think I want to do this. So if you own a business, make sure your business is inviting and doing things correctly. Have good signage. Have people, because people feeling safe are going to come back. People feeling that it's sketchy are not going to come back. Trust your instincts. Bars are super fun. I love to go to the bar, but bars right now are like a snake pit. Restaurants are potentially sketchy because any place where you are relying on other people's safety protocol, which means every single patron, that's risky, especially if the folks are partying. They let their inhibitions down. They're not wearing their masks. Get out of there, risk getting sick because this thing is really rising. Don't congregate inside enclosed spaces. I've walked around all kinds of office buildings in Missoula and elsewhere, and people are just walking around in narrow hallways that are 4 feet wide and going right past each other. And that's really not smart. Wear a mask. So don't touch your walls in your workplace. Don't walk around because I have a habit. I talk to someone, I put my hand on their door frame or something. Try to avoid doing that. Try to consciously think that you'll burn your hands if you touch anything. That's not a bad protocol to follow. Your countertops are the same thing. You need to sanitize your hands immediately if you're touching anything. When you leave your carefully cleaned and maintained personal space to walk around, put on your mask. When you're in your cleared and distanced personal space and you have no symptoms, that's very important, mask off. If you have symptoms, stay home. This is a really long-term deal, and we have to learn to do this. These should be your new habits for everybody in society. Problem is, not a lot of people are bright enough to have that kind of. Let's talk about personal responsibility. To manage this illness, we're asking a lot out of people. When you're dealing with stress, depression, inconvenience, we're asking you to maintain focus, discipline, and the consistency of like a top performer, like an Olympic athlete or an Olympic skater. Oh, was that a perfect routine? Did I touch things? Did I do something? You can sort of think of it in those terms. Not everybody's intelligent enough and emotionally able to maintain this, what in the military they call condition yellow consistently. But if you don't want to get this thing, you got to be on condition yellow. But you can do it. It's Montana. Let's cowboy up. And so we start getting into what's happening. The older and more vulnerable population demographics are taking this disease seriously. We've had 7 months of this incident. And we have finally learned to be careful with our elder people, our people who are at most risk. And those people are managing themselves as a good rule. You'll still see the old guy that refuse to wear a mask going in the post office, and ranchers, and humans aren't homogenous in that way. They're going to behave the way they're going to behave. The problem we're having is the 15 to 29-year-old demographic. Not so much. They're not cooperating much. Our current boom is in these younger folks. The natural consequences of the swing will be another ramp upward. We're expecting that the older demographics are going to be affected when we have winter and holiday season approaching. And the young folks who are running around Missoula and Bozeman go back to the folks for the holidays. They're going to harm the older population. They're really not following the protocols, and we see them all the time, daily. Yesterday, they went to a park in Missoula, and there were a whole bunch, like 20 guys with no shirts on, playing basketball and sweating all each other. And then you tell them, hey, you guys need a mask, and they just tell you to buzz off. So this is sort of common. But the one you don't think as much about, maybe you do, because if you're employers, let's profile a common demographic of a younger worker in Missoula in the autumn. This typical person might have multiple jobs to pay their bills because they're not paid enough to pay their bills otherwise. So they work for a caterer, a bar, maybe they do another gig economy job, Uber or something like that. Maybe they work for you. They wear a mask and they maintain the distance while working, and they follow all the rules. And the moment they're off work, they have to socialize with all their friends, often without a mask, and then we have a perfect storm. And I see this all the time, and I see this, directly. I see it directly. Employers ask me if they can make their young employees get tested. Can I make them get tested? Because I don't want the thing. And without an admission or illness or symptoms, they can't. You cannot demand them to do it. Another example, I have one person I was talking to the other day who what they do is employees call in and go, I have symptoms today. So they go, okay, then don't come in. And then the employer says, why don't you go get tested? And then they'll say, oh, I'll take your advice. And then they hang up, and then they get a free day off paid. Some people are kind of, will pay you, And then the next day they say, I'm fine, I'm 100% fine. And they go, I thought you, they're using it as a tactic to just get a free day off. It's becoming a real common thing, at least in Missoula. I hope that's not happening to you folks in your businesses. So that's an issue we can talk more about. This carefree characteristic of young people is a byproduct of their upbringing, their experience. We haven't asked very much of the youngest generations. They've had a pretty cushy life. They haven't faced much adversity. It's not like we're in a country with war and civil war and things happening. Now we need to self-control and sacrifice. Every one of us, I don't know about you, we've all sacrificed for this virus. Sometimes life isn't fair. Everybody's about to sacrifice even more. That's the key point of this thing is this is not pinch yourself. This is real. I mean, I don't know about you, but I thought I was living in a movie most of this time. And now all of a sudden, I don't know when it sunk in for all of you, but this thing's real. And you don't want it. You do not want this virus. So I've interviewed lots of people who've had it. Some of them it was mild, and almost, I'd say 70% have some after effect that's not coming, they're not healthy. This virus is troublesome in family gatherings, indoor businesses, anywhere people congregate. Every time you enter these places, you risk the potential to make someone sick. You can be tested negative, walk out of the testing facility, walk past someone, and guess what? You can't rely on your result anymore. So clean every surface that people touch after meetings and when leaving your personal workspace. And what's important is spray your desk or spray whatever you're spraying and leave the product on there so it can do its job. Don't immediately wipe it away. The product needs to sit there for a wee bit before you actually, then wipe and throw away the towel in an enclosed container away from the people. Doing this right means your hands will be raw from cleaning. I don't know about you, most people's hands are really raw. So keep sanitizer and some sort of moisturizer handy if that's necessary. Women are much better at this than men. And men actually get where they won't wash their hands because their hands will get raw, we found. Just being considered someone else's close contact will earn you an inconvenient 2-week quarantine. And you don't want that. And that can really ruin your business. So minimize your contact group to a small group of smart, careful friends. Of everything I tell you today, this is keystone number 1. Minimize your contact group. Don't just go, oh, Jan's been my friend forever, so we're going to go have a drink. You know what? If you do that, go on the porch, stay real far away, and keep it at that. Don't go hugging your old friends. These things are, everyone breach of, pretend that they're on fire. Everything's on fire, you guys, if you want. And don't do that. Follow your health department's guidelines and ask questions. There are no dumb questions, really. And the same questions get over and over, and there's no reason not. And my information's in the chat. You're welcome to contact me. I have 2 most frequently asked questions for business managers. 2 scenarios go like this. Number 1, we've got an angry person in our store who refuses to wear a mask. What can we do? Some people are calling the police going, there's someone not wearing a mask. Well, that is not the tactic to use. The important context here is in the actual violation that has occurred. That violation, according to Montana codes annotated, is trespassing. There's no mask order ordinance on which to rely and call 911. The person will not leave the space under your manager's control. The business owner is obligated to ask the person to leave. That's important. The business manager owner has to say, you're not wearing a mask, we're asking you to leave. If they refuse to leave, state that you'll call the police or the sheriff's department, whichever, and have them trespass from the premises. When you call 911, this is very important. Merely report that someone is trespassing. Say, hey, we have someone here trespassing. Be sure you use that language when you call. Otherwise, they're not going to respond because they're going to tell you, we don't come out for mask ordinances, but they will come out for trespassing. That they have no mask is actually secondary to this situation. So we had a lot of problems early on where all kinds of businesses are going this, and there were people going around Missoula filming themselves, look at me defying these non-constitutional orders, and then put it online and doing these things. And they'd say, please leave, in grocery stores and things. And the solution really is to have them trespass. The other most frequently asked question I get is, someone came into my store with a medical exception to wearing a mask. There are these charlatans selling fake medical passes in Missoula. I don't know if they're doing it elsewhere. I know they're doing it in Billings. And for $10, they give you a little card saying, I have a medical exemption. And then if this is the case, ask the individual if you can provide curbside or carside service for the products they need within reason. And usually they'll just go and they'll walk away. You'll find them come back tomorrow with a mask on because they've already tried these silly tactics at other places. There's really no valid medical exception. You will know if someone is indigent and really needs your help, and you can judge that. It's your private property. Protect your private property and control your own business. The virus is testing our limits, so be patient, be a good sport. The only way to run our economy is with some sort of modicum of control. If you manage a business, set policies that meet stringent guidelines. Ask your employees with symptoms to stay home. Encourage them to get tested. Think of the survival strategy of staying in business by keeping COVID out of your workplace. You're entitled to even set more stringent policy than the health department. You can make your own health rules. You really can do that with your own business. And people don't have a right to be in your business. They have a right to follow whatever policies you've set. I repeat this, you can set more stringent standards than the health departments if you want. The SARS-CoV-2 virus has not been kind to small businesses. The key to staying open is to stay safe. Safety includes keeping your business staffed. You can anticipate a plan for management succession in case you go down. You can take an online course through FEMA. If you Google, I think it's like businesses during COVID. FEMA can take you through an 8-hour course, and basically it talks about getting your affairs in order in case you get COVID yourself, if you go down. Having reserve personnel who properly maintain their own safety to fill in for your regular employees can be really important too. I know several restaurant owners who have pooled together and like a resource of all kinds of people who are capable of working, and they're actually sort of banding together to find people. So if someone's down or someone's in quarantine, they have like a bullpen, actually. It's pretty cool. You might want to plan with your banker or your financial manager what to do if the virus affects your viability. You'd never really think of that, but it's important. Of course, you're already invested in added costs for sanitation. I'd also say take care of your mental health and those of your employees. This is starting to wear on us. Stress is a killer. We all know that. You'll need sunshine, exercise, good nutrition, hydration, plenty of sleep. We all want to make it to the finish line. These viruses are an integral part of our society for a long time to come, and we want to see a new normal, just like the old normal. That normal is going to only come gradually, and it's going to come after many more tomorrows. So hang in there. So at the moment, it looks like it's time to open up for questions.
Yeah, it is.
So let's do it.
All right, we've got 3 that have come in with the chat window, so we'll start with those and then we'll open up the floor. So the first one I'll start with is because it was kind of a clarification of something you said. When you were referring to the trespassing, is it considered private property if a business is leasing the space for their business and it's not owned by the owner of the business?
My understanding is the controlling manager controls the space. Yes. That is, you've leased it, you're the manager of that space. If you control that space by known contract, then you control the space. Yes. All
right. Let's move on to the next one. I know this one certainly has been true here at MSU as well, but the comment is, winter is coming. I've been operating with doors and windows open to get additional airflow. What is my best choice going forward, understanding that, closed spaces are more dangerous, but winter is coming?
Well, you're going to have to rely on masks and people not coming in with symptoms or not coming in when they're sick. What's a weird thing to think is in Missoula, I can't say all, but let's say we have a little over 100,000 county population. There are about 4,500 people at any one moment walking around with COVID that haven't been tested and we don't know it. So they're walking around, they're shopping, they're coming into your business. Hopefully they're wearing a mask, wouldn't that be great? But that's just a fact. They're walking all over the place. That's just the current statistic. So you can scale that to the size of your community or whatever. And then we have travelers, people coming off the highway. So it is pretty darn dangerous. And the mask is still the best method at the moment, according to epidemiologists. Most researchers, people in the disaster community, a mask is still the best idea at the moment, and make sure they have it over their nose. It's really critical. About a third of the people have the mask below their nose. It's just idiotic. And you tell them, they go, "Oh, what are you talking about?" But yeah, put your mask on. So that's important.
Okay, thank you. We got another one here. Are cloth surfaces a risky surface for contact? Do I need to quarantine my clothing? It's my understanding that other businesses are not allowing people to try on clothing in their store. Can you talk a little bit about the risks around cloth surfaces there?
Well, that's a certain risk, just like we all know if you blow your nose into your mask or you breathe through it all day, you better wash it. So that's a heck of a great question that I can't completely answer because honestly, out of 7 months of this, first time I've ever heard it. But I would be very, wow. That's a good question. I think the best thing I would do is put that rack of merchandise out in the sun, which could fade it and ruin it UV wise. There's other consequences to that, but that's what I would personally do. It's not any sort of official policy, but I would try to get that merchandise out in the sun or put it in the window with sun if someone was trying it on, and not maybe wait a few days till you put it back in the rack or something. That's the best idea I could come up with, but I'm not in that business. I'm not a clothing haberdasher, any of those things. So I don't really know. But and I'm gonna bring that forth because that's a blinger. I like it.
All right, thanks, Stephen. I've got the clarification, I think, on one of the things you mentioned a little bit earlier about if you've been reached out to, that you were in close contact with someone that has test positive. You said there's a 2-week quarantine period, and I've heard that
Yes.
before. Does getting a test and having a negative result end that 2-week quarantine period, or is that
No.
a different concept?
It does not. And it depends, and they may change some of this. Belgium, for instance, yesterday instituted a 1-week quarantine because so many people were breaking quarantine that they figured shortening the quarantine would maybe have more compliance. But the disease, and you can, every human's different. Some people will be 3 days and they're clear. Some people, but 2 weeks is sort of the CDC standard. And the health department will release people and give them a letter after 14 days. And of course, the correct test. So the other thing that I'm glad you brought this up, because once you've had it, I've had friends with the disease. Once you're cleared, don't run out and go to the bar and post on Facebook, whoopee, I'm cleared. Because guess what? You can get this thing again. There is proven cases of people getting it again. So you really don't want to, you want to continue wearing your mask. You want to continue with your COVID protocol. Unfortunately, it's not like you won the Willy Wonka thing that you're over the disease. That's not how it works. You can still get the thing again. That's the worst part about the whole COVID thing is they've yet to figure out that you're clear. So.
All right, thanks for clarifying that. And that's all the questions that have come in. So I'll open it up to anybody that wants to send one in. It looks like Jason, you might be up first.
Yeah, I just wanted to just chime in based on things that I have read. There is a handout from the FDA to healthcare providers that very clearly states that a negative test should not be the sole determining factor because of the false positives and false negatives or whatever it may be rates. The earlier in an exposure you are, the more likely you are to test negative. So the negative test should not be the sole determining factor. It's the negative test plus the quarantine period of 14 days. And I think that's what's coming from FDA and CDC, kind of almost in spite of some of the other what you may consider reliable sources of information. That's what I defer to. I'm dealing with this on a personal level on a couple of different occasions.
I see. And also, you need to be clear of a fever for 48 hours without utilizing any fever-reducing prescriptions or drugs. There's a bunch of other caveats attached to that release factor. But yeah, good point. Thank you.
We've had another question come in the chat window. Who should small business owners contact if they have questions about business operations regarding COVID in general, and maybe specifically for Missoula County, but also for other parts of the state?
Well, for Missoula, you can call me. For other parts of the state, I can refer you to my colleague in their part of the state. But our function is a communication function attached to deal with all the entities that have to deal with COVID as it's attached to their local health department. So I'd be glad to refer you to the right place if you'd like. And my information's in the chat, I believe.
All right, thanks, Steve. Are there other questions? You're welcome to unmute yourself and ask if you'd like, or send them in via the chat window.
I'm really curious if anyone has any other strange anomalies that help us learn so that we can react better to this whole situation.
I'll ask a question.
Thanks, Jennifer.
Yeah, one of the things I've seen a lot about is that HVAC upgrades can help indoor situations for disease prevention, but I haven't seen a lot of activity in the community in replacing HVAC systems or in public spaces or businesses or schools, although I've seen a little bit. Are you guys getting questions about that? Is that going on? Is that a strategy that's reasonable for people to use?
People were very concerned, of course, with the schools opening. And so I think the schools clean their HVAC systems, which you can do, and they put a chemical through there. You know, on a large home, you'll get 2 garbage bags full of dust mites, pollen, all kinds of incidental material when you get your ducts cleaned. So old systems are old systems. I have some like mold allergies, and there's certain buildings I go into, and I just go in and I'm miserable. And all of those illnesses, the pollen, those other things, make you more susceptible to get COVID. Certainly, it weakens your system. So that's a difficult thing. You know, it's very expensive to change out your HVAC. Your regular maintenance should certainly be done at the right interval. That's a given. So that's an interesting point. But I would recommend anyone have their HVAC system cleaned and maintained properly. And some of them are ancient. Some of the public buildings, some of the old buildings, the system is just ancient, and it could contribute to other forms of illness besides COVID.
So I'm guessing my 1907 radiator that I'm sitting next to wasn't designed to kill COVID when it turns on.
Probably not.
But there's no
Probably
air
not.
that comes to other parts of the building, so maybe that's a plus.
I keep a filter device with me if I'm going to be anywhere for a long time, for like 6 hours or something. I literally drag it around in my truck and plug it in, and I change the filter, and I do that. And some environments, if I'm feeling it, I'll wear a mask while I'm working. That's just, even if it's private space. I've just been doing that. And, you know, I keep a rotation of masks, and I wash them, and I keep like 4 of them hanging on a hook that are clean, and like, this one's up. Okay, let's use this one now. And I launder the other ones. That's really pretty important too. And get the soap out. So a lot of soaps will irritate you. And every single one of us at some point during this thing, in your mind, you go, oh my God, I've got COVID. Oh my God. You wake up in the morning, I think I have COVID. And maybe you have a stuffy nose. So hopefully some of that natural occurrence, it's not COVID, doesn't freak us all out. But that's a good question, Jennifer. I'm sorry if I'm going roundabout, but I don't have a solid, definitive answer for you.
All right, thanks, Steve, and thanks for the question, Jennifer. Other questions or situations anybody'd like to share? This is probably not the most exciting meeting, Steve, you've had as a health department member over the last 6 months.
Well, no, not really. Nobody's called me a goose-stepping Nazi today, so that's good.
All right.
That's happened. I've been yelled at that at me and walking down the street. So, yep.
Joel, since this is recorded and going to be distributed, the recording, we probably should date stamp this and just say, you know, today is Monday, October 1st, 2020. As the SBA representatives in the room, SBA has basically made the recommendation to make the best decisions based on the information that you have at the time. And so it should be noted that today's October 1st, 2020. So make the decisions based on the information on this date.
Yeah, thanks.
I stated previously that my personal opinions expressed here do not represent official policy of the Missoula County City Health Department.
Yeah, and Steve, I know when we visited earlier, you mentioned, you know, we're still learning a lot collectively about this virus. So I'm sure that as time moves forward, we'll refine recommendations and maybe improve protocols in some different areas as well. So it's good to note that, you know, today is October, and I'm guessing we're going to know a lot more by February or March or April about the coronavirus.
Well, I hope so. Well, thanks for having me, Joel. If there's no further questions, and everyone do your best and hang in there and take care of your mental health. It's really critical, and just do your best. That's all we can do.
All right. Well, thank you, Steve. And for those of you that,
you're welcome.
And thank you for joining us, everyone, today. And thanks, Steve, for being there. And then mark your calendars again for November 5th, and we'll have our next monthly session, and we will be talking about credit card processing next month as well. So thank you all for joining us.
Thanks. Have a good day. Thank you, Joel, for having me. We'll see you around.